IP data because the administration seems to be under increasing pressure to share IP data from doctors and even some global leaders. But Dr. Fauci recently joined industry during a television interview to say that that is perhaps not the best way to get shots in arms. And I was just wondering what the official White House view is on that.
I wouldn't say that's an exact characterization of his comments or remarks that he made, but I will say that I would expect we'll have something to say about this once the WTO session gets underway. Obviously, Ambassador Tai would be making a recommendation to the president. That's not something that has happened at this point. And obviously, just for people to understand, for everyone to understand this process, because sometimes it's shorthanded on television or in other places, what we're talking about is the United States position. It's a WTO process, and what ultimately happens here will not be up to the United States alone. This is a waiver that there would have to be agreement among WTO members on. I think what I saw Dr. Fauci's comments speak to as well, which is certainly our position, is that our objective is to save lives by producing as much supply as possible and getting shots in arms around the world in the most effective way. And we're determining what the right steps are to do exactly that.
Okay, thank you. And one last one on India. I know I've been asking you constantly about that, but it's obviously really important. Is the administration doing all it can to help India?
Well, let me give you an update, and I know we've provided a few of those, but I don't think we've done a substantive one here on what has happened or what the recent shipments have been. So 6 air shipments funded by USAID have departed the United States, 5 of which have already arrived in India. These flights include health supplies, oxygen supplies, N95 masks, rapid diagnostic tests, and medicine. And these are a lot of the components that the Indian government has expressed a vital need for. More flights are on the way, with total assistance expected to exceed $100 million. At the request of the government of India, USAID provided these urgently needed supplies to the Indian Red Cross to ensure they reach those most in need as quickly as possible. In terms of oxygen support, which, as you all know, is a big component of what they need right now, we're talking about oxygen cylinders. So USAID delivered approximately 1,500 cylinders that will remain in India and can repeatedly be refilled at local supply centers, with more plane loads to come. Oxygen concentrators, USAID has sent approximately 550 oxygen concentrators to obtain oxygen from ambient air, and USAID has also delivered a large-scale unit to support up to 20 patients each of an oxygen generation unit. We've also sent 2.5 million N95 masks, and we have an additional 12.5 million N95 masks available should that request come from the Indian government. And we've directed our own order of AstraZeneca manufacturing supplies to India, allowing India to make over 20 million doses. We've also provided 1 million rapid diagnostic tests. And this past weekend, USAID delivered 20,000 treatment courses of the antiviral drug Remdesivir to help treat hospitalized patients. We're also working, one of the questions that's come up is about assistance and know-how, and CDC experts will work in close coordination with India's public health experts in the following areas: laboratory surveillance and epidemiology, I'm not a medical expert, emergency response and operations development, bioinformatics for genomic sequencing and modeling. So we are in close touch. That's a summary of what we've done just over the last several days, and we're working to meet the immediate needs they have now, even as we consider, when we have AstraZeneca doses available, what can happen there. Okay, go ahead.
Thank you.